the heart of Limpopo in Mokopane today, where we've been delivering our cancer screening services to the medically uninsured, together with partners such as Campaigning for Cancer and Lancet Laboratories.
This day is one of the greatest days that we have in the history of our outreach programs. You know, the benefit of such taking services to where people live is that you can actually focus on primary health care, get people tested today and get the results today or next day, and then you can prevent getting complications of cancers, of any other illnesses. So we as a Department of Health would have to really strengthen this outreach together with the partners like PinkDrive. By the time people come to our hospitals because they suspect some lesions, some abnormalities, it's too late. So this is a way to go, and we will strengthen this. And if there is a cancer, we can intervene early and actually save a lot of lives.
We know that the chronic conditions tend to be a challenge of the century. And we know that most of us are more focused on treatment than screening. We know that when people are aware of their conditions, when people are screened, then they can prevent disease much earlier. And today we are proud to be hosting PinkDrive, which have come full force in partnership with Lancet, whereby you are able to do your pap smear, you are able to do your mammogram, you are able to do your PSA, and Folang has brought their in-body scale where you'll be done your weight. And we know that obesity is the biggest challenge of all the chronic conditions, whereby, in fact, it's the biggest pandemic compared to COVID-19, HIV, TB, and everything. So we are saying, let's come together as a country to deal with these health challenges, because your health, you know, is your first wealth. And we appreciate the work done by University of Pretoria, which have brought more than 100 students. We appreciate the work done by the University of Limpopo, who is bringing their students to learn, but also to give value, to give back to their communities, because we know only life lived in the service of others is life worth living.
Today we have brought along with us a variety of students in the faculty. Part of the university and training of students is working with the community, and this is an absolute ideal environment for them to actually work with patients and also learn what they will be doing in the workplace one day, and to give back to the community. And what's nice is the students are rotating as well, so they're learning how to educate, but they're also learning how to check on patients, do pre-ops, etc.
Our approach is, I think, in synergy with what the PinkDrive is trying to achieve. Our relationship with PinkDrive and other similar entities is long-term, so we see a very positive future for the South African healthcare system. Lancet Laboratories will be part and parcel of closing the healthcare gap in South Africa.
Campaigning for Cancer is here today to make sure that we explain our self-examination app to community members who are attending the day, as well as explaining the importance of monthly examinations and checking on their health. The feedback for the app has been really, really good. We've worked with communities to understand what are some of their needs early on in the days, and it's good to see that we're answering most of those needs with the app.
We are here in Mahwelering to do a cancer awareness for our people, and this is a free service that we're giving to our people. From my interaction with the public, they want more of such services, because you know the clinic will make you wait a long time. The hospital appointments take forever for you to get them. All of them are always asking, when are you coming back again? When are you coming? So more would be good, you know, so that more people get screened and more people get to know about these life-threatening illnesses.
Mokopane is usually forgotten. People never come here to offer such services or anything. They just pass through and go to Polokwane, forgetting that, remember, there's Mokopane and it's a town before Polokwane. We are never recognized. So to have the PinkDrive here and offering these services is amazing. We are so thankful and grateful.
I would like to advise all the women, even men, to come and do the test here. As they can see, it's for free, because some of us can't afford private hospitals or doctors.
And I must say I'm totally overwhelmed once again how the community has come out and embraced the services that are being delivered to them. None of this would have been possible if it wasn't for Dr. Molomo, who is from Limpopo and contacted me to help him bring the services to Limpopo. Without our funders, we wouldn't be here today. I'm eternally grateful to corporate South Africa for their generosity. I once again appeal to National Department of Health to assist us with funding, because with their funding we'd be able to build more trucks, help more people, because at the end of the day, early detection will prolong a life.